Welcome back to Medical Simplified and Facts. In today's video, we're covering the top 50 high-yield anatomy recall questions. Question 1. Erb's palsy involves which nerve roots? Answer: C5 to C6. Injury to the upper trunk causes loss of abduction at the shoulder and external rotation of the arm, giving the classic waiter's tip position. Question 2. Klumpke's palsy involves which nerve roots? Answer: C8 to T1. Injury to the lower trunk causes weakness of the intrinsic hand muscles, resulting in claw hand. Question 3. Which nerve is injured in wrist drop? Answer: the radial nerve. Its injury causes inability to extend the wrist and fingers, giving the classic wrist drop. Question 4. Which nerve is injured in foot drop? Answer: the common peroneal nerve. Its injury causes weakness of dorsiflexion of the foot, leading to the steppage gait. Question 5. Winging of the scapula occurs due to injury of which nerve? Answer: the long thoracic nerve. Paralysis of the serratus anterior causes the medial border of the scapula to protrude posteriorly. Test with the push against the wall sign. Question 6. Ape thumb deformity is due to injury of which nerve? Answer: the median nerve. Paralysis of the thenar muscles causes loss of thumb opposition, so the patient cannot oppose the thumb. Question 7. Claw hand is due to injury of which nerve? Answer: the ulnar nerve. Paralysis of the interossei and lumbricals causes hyperextension at the MCP and flexion at the IP joints, so the patient cannot abduct or adduct the fingers. Question 8. What is the most common site of ectopic pregnancy? Answer: the ampulla of the uterine tube. Around 70 to 80% of ectopic pregnancies occur here, since the ampulla is the widest part of the tube. Question 9. What is the blood supply of the head of femur? Answer: the medial circumflex femoral artery. It's the main supply in adults, critical to remember in neck of femur fractures. Question 10. The danger area of the face drains into which structure? Answer: the cavernous sinus. Facial veins lack valves, so infection can spread directly into it. Even a pimple on the face can lead to cavernous sinus thrombosis. Question 11. Surgical neck fracture injures which nerve? Answer: the axillary nerve. This nerve is injured in surgical neck fractures of the humerus. Look for loss of deltoid innervation. Question 12. What is the most common ectopic pregnancy site? Answer: the ampulla of the uterine tube. Around 70 to 80% of ectopic pregnancies occur here, since the ampulla is the widest part of the tube. Question 13. What is the blood supply of the head of femur? Answer: the medial circumflex femoral artery. It's the main supply in adults, critical to remember in neck of femur fractures. Question 14. The danger area of the face drains into which structure? Answer: the cavernous sinus. Facial veins lack valves, so infection can spread directly into it. Even a pimple on the face can lead to cavernous sinus thrombosis. Question 15. The afferent limb of the corneal reflex is through which nerve? Answer: the ophthalmic nerve, V1. Corneal sensation travels through the ophthalmic division of the trigeminal nerve. Question 16. The efferent limb of the corneal reflex is through which nerve? Answer: the facial nerve, cranial nerve 7. It causes closure of the eyelids. A lesion here means loss of the blink reflex. Question 17. Bell's palsy is due to injury of which nerve? Answer: the facial nerve, cranial nerve 7. It causes idiopathic paralysis, an LMN-type facial palsy. Question 18. Recurrent laryngeal nerve injury causes what? Answer: hoarseness of voice. This nerve supplies all intrinsic muscles of the larynx except the cricothyroid. Remember, the left RLN loops under the aortic arch. Question 19. The phrenic nerve arises from which roots? Answer: C3 to C5. It's formed by the ventral rami of these roots and is the only motor nerve to the diaphragm. Question 20. The diaphragm's motor supply is by which nerve? Answer: the phrenic nerve. It's the sole motor supply. Damage leads to diaphragmatic paralysis. Question 21. Foramen rotundum transmits what? Answer: the maxillary nerve, V2. It passes through the foramen rotundum from the middle cranial fossa to the pterygopalatine fossa. Question 22. Foramen ovale transmits what? Answer: The mandibular nerve V3. It passes through the foramen ovale to the infratemporal fossa. Question 23. Foramen spinosum transmits what? Answer. The middle meningeal artery. It enters the cranial cavity through the foramen spinosum. Question 24. Jugular foramen transmits what? Answer. Cranial nerves 9, 10 and 11. The glossopharyngeal, vagus and accessory nerves all pass through here. Question 25. Superior orbital fissure transmits what? Answer. Cranial nerves 3, 4, 5, 1 and 6. This includes the oculomotor, trochlear, ophthalmic and abducens nerves. Question 26. What are the contents of the carpal tunnel? Answer. The median nerve. It passes through the carpal tunnel along with the flexor tendons, FDS, FDP and FPL. Question 27. What is the lumbar puncture site? Answer. L3 to L4 or L4 to L5. The spinal cord ends at L1 to L2, the level of the conus medullaris, so LP is done safely below this level. Question 28. Cisterna chyli is at which vertebral level? Answer. L1 to L2. It's a dilated sac in the abdomen located at this level. Question 29. The thoracic duct drains into what? Answer. The left venous angle. It empties into the junction of the left subclavian vein and left internal jugular vein. Question 30. The right lymphatic duct drains into what? Answer. The right upper quadrant, specifically the right venous angle, the junction of the right subclavian and right internal jugular vein. Question 31. Portal vein formation occurs by union of what? Answer. The superior mesenteric vein and the splenic vein. The splenic vein joins the SMV behind the neck of the pancreas to form the portal vein. Question 32. Appendix blood supply is by which artery? Answer. The appendicular artery. It's a branch of the ileocholic artery, which arises from the SMA. Question 33. McBurney's point is related to what? Answer. The base of the appendix. It overlies the base of the appendix, located 2/3 of the way from the ascis to the umbilicus. Question 34. Calit's triangle contains what? Answer. The cystic artery. This triangle contains the cystic artery, cystic duct, and common hepatic duct. Remember it as CCCD. Question 35. The spleen develops from what? Answer. Mesoderm. It develops from mesenchyme in the dorsal mesogastrium. Question 36. The pancreatic tail drains into what? Answer. The splenic vein. Both the pancreatic tail and spleen drain into the splenic vein. Question 37. What is the most common inguinal hernia? Answer. Indirect hernia. It enters through the deep inguinal ring, lateral to the inferior epigastric vessels. Remember, direct hernia is medial. Question 38. Femoral hernia lies below which ligament? Answer. The inguinal ligament. It passes below the inguinal ligament through the femoral canal. Question 39. The femoral sheath contains what? Answer. Artery, vein, and canal. The femoral sheath contains the femoral artery, femoral vein, and femoral canal. Remember it as AVC. Question 40. Broca's area is located in which gyrus? Answer. The inferior frontal gyrus. It's found in the posterior part of the inferior frontal gyrus in the dominant hemisphere, and it's responsible for speech production. Question 41. Area of auscultation for aortic valve? Answer. Second right intercostal space at right sternal border. Pearl. Aortic area to second right ICS. Question 42. Intercostal nerve supplies? Answer. Skin and muscles of thoracic wall. Pearl. Intercostal nerve to thoracic wall. Question 43. Ansa cervicalis is formed by? Answer. C1 to C3. Anterior rami of C1 via hypoglossal nerve C2 and C3. Pearl. Ansa cervicalis to C1 to C3. Question 44. Hilum of kidney transmits which structures? Answer. Renal vein, renal artery, renal pelvis, lymphatics, nerves. Pearl VAP rule. Anterior to posterior. Vein, artery, pelvis with lymphatics and nerves. Question 45. Phrenic nerve is motor to which muscle? Answer. Diaphragm. Phrenic nerve, C3 to C5, is its only motor supply. Pearl. Phrenic nerve to diaphragm. Question 46. Vagus nerve is motor to which muscles? Answer. Soft palate, pharynx, larynx. All except cricothyroid. Pearl. Vagus to all laryngeal muscles except cricothyroid. Question 47. Main artery of upper limb is? Answer. Axillary artery. Continuation of subclavian becomes brachial artery at lower border of teres major. Pearl. Subclavian to axillary to brachial. Question 48. Testicular artery arises from? Answer. Abdominal aorta. Arises from its anterior aspect just below the renal arteries. Pearl. Testicular artery to abdominal aorta. Question 49. Carotid sinus is present at which level? Answer. Bifurcation of common carotid artery. A baroreceptor located there. Pearl. Carotid sinus to bifurcation of CCA. Question 50. Deep perineal pouch contains? Answer. Membranous urethra and external urethral sphincter with compressor urethrae muscle. Pearl. Deep pouch to membranous urethra plus EUS. Thank you for watching. Like, share, subscribe and comment your score out of 50 below.